morning, Mrs. Jones. My name's Jessica. I've already done your assessment today, but I'm actually going to be doing baby Henry over here's assessment. So I'm just going to wash my hands. And then I'm just going to be checking the ID band here just to make sure that we have the right baby. And we do, so that's good. The first thing that I'm going to be checking here are vital signs. So I would check the temperature underneath his armpit. And that should be between 97.5 and 99.5. So that looks good. Next I'm going to be checking for pulse and respirations. Pulse should be between 100 and 160. And then respiration should be between 30 and 60. And these are best heard with the stethoscope. And you need to listen for a minute for each. And then after I'm finished with that, I'm just going to be checking his heart sounds to make sure there's no murmurs or anything like that. And then checking for bilateral breath sounds as well. And then after I'm done with that, I'm just going to move down and listen to baby's bowel sounds. All right, everything looks good there. So I'm just going to try to keep baby warm throughout this whole process. Next, I'm just going to take off his hat. And I'm going to be feeling the head here. I'm going to check for any molding, which is normal in newborns, but it does need to be noted and charted. I'll be feeling for the anterior fontanelle and the posterior fontanelle. Those are often described as soft spots. I'll be feeling for the sutures as well, just to make sure that they're not too far apart. And then caput, which is just generalized swelling, I would be checking for that, which is different from a cephalohematoma, which is just swelling in one area. And then I would be checking for any scratches or any bruising, because that can happen during birth as well. Next, I'm going to be looking at the eyes. The eyes should be symmetrical. They should line up with the top of the ear. And there shouldn't be any extra epicanthal folds. That could either indicate that he might have Down syndrome or that he's of Asian descent. I'll be checking for any kind of discharge. It should be 1/3 all the way across. And then I'll be checking for any subconjunctival hemorrhage, which is not present. Next, I'll be looking at the ears. Just like with the eyes, they should line up with the corner of the eye. And then for the cartilage, you should be able to just bend baby's ear back and it should go right back. It's just a sign of maturity. If he was a preemie baby, it's possible that that wouldn't just fold back. Next, I'm going to be checking for patency with his nose. So I'm just going to cover up one nostril and just feel the air coming through the other side, and then do it the other way as well. Next, I'm going to be looking at his mouth, so I'm going to put on gloves for this. And as I come closer to baby's mouth, baby should start having a sucking reflex, and then I would just put my finger in his mouth and he should be sucking. Feeling the palate, checking for any cleft lips or anything like that, and everything looks good there. So next I'm going to just be feeling the neck. We're going to be checking for any masses. I don't feel any, and then we'll be doing range of motion with baby as well, just to make sure that the neck turns both ways. So that's great. Next, I'm going to be checking the clavicles just to make sure they're intact and not broken, because sometimes they can break during the birthing process. And then throughout all of this, I'll be checking baby's skin for any peeling, any birthmarks or rashes that need to be noted. There shouldn't be any vernix present, but I'll check for that. And then there might be a moderate amount of lanugo, which is just the tiny hair. I'll be checking for any bruising or anything like that. Babies are always described as being pink unless they are cyanotic, so I would be checking for his color as well. And then for skin turgor, I could check that on his belly, or I could check it on the inner thigh as well. Jaundice in the 5 different areas would be the forehead, the chest, the abdomen, and the thighs. And then as it got worse, it could even get into the sclera of the eye, so I would just want to be checking for that. For respiratory, I would be listening for any grunting, any nasal flaring, any seesaw respirations, apnea, or any retractions while he was breathing. With the abdomen, it should be slightly round. and then it shouldn't be distended at all. It should be soft to the touch. And then the cord should be dry, and there shouldn't be any discharge coming from that either. Next, I'm going to be looking at baby's genitalia, so I'll definitely put on gloves for that. And I have a male here, so I'm just going to be checking to make sure that the testes are descended. So just kind of feeling for a marble shape in there to make sure that they are. We need to make sure that the meatus is on the tip of the penis and not on the upper or the lower. And then we'll be checking for rugae in the scrotum as well. If this was a female, we would be making sure that the labia majora was covering the labia minora and the clitoris. Baby back up here. Next, I'm going to be checking for tone. So I'm just going to lift baby's arm up and then bring it back down, hold it for 3 seconds, and then baby's arm should recoil back up. I'm going to be looking at his palms to see how many creases he has. He should have 2 or more. If he only has 1, that could be an indication of Down syndrome. We do need to count all the little digits. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So all of that looks good. I'm just going to cover baby up and come down to his feet. So baby should just have creases there. There's not a specific amount. And again, 10 toes. So we'll count again. 1, 2, 3, 4, 5. 1, 2, 3, 4, and 5. And then we should be checking for the Babinski reflex as well. And that's where you're just going to go in an upward J motion, and then baby's toes should flare out. That's normal in newborns, and will decrease as he gets a little bit older. Then I'm going to flip him over and we're going to look at his spine. So I'm just going to feel the spine for any kind of abnormalities, check for dimples or any kind of hair tufts or anything like that. For his hips, we're going to be looking for the gluteal smile. We're going to be checking to make sure that all of the folds are symmetrical and that the legs are about the same length. I'll flip it back over. And then for the Moro reflex, that's where you would just clap or bang on something, and baby's arms should come up, and then the thumb and the forefinger should come into a C shape, and that's a normal reaction for the baby. Throughout, the baby was sleeping. He did get a little bit fussy as we continued, but that was good. If I had noticed that baby was wet or had had a stool, I would change the diaper, and then I'd be checking with mom as to when the last time was, since babies do need to void every so often and so many times per day. And then I would ask about the next feed, and just make sure that everything's going okay with mom in those terms, and that's everything.